Hello everybody, my name is Brian Bowen. I am a Renewed Vitality Health and Wellness team member. Please check us out at renewmyhealthnow.com. I'm an acupuncturist, manual therapist, herbalist, and postural alignment specialist. This is the second health tip I'm bringing you today, and my first feeble attempt at making an infinite white background. So an iron and about 20 more lights, and I think I'll have this thing down, so I appreciate you being forgiving with this. So second health tip. What I want to talk to you today about is position versus condition. So a lot of times the joint pains that we have, the arthritis, the wearing down of the cartilage, all the inflammation, the itises, whether it's bursitis or tendonitis and stuff, usually come for many times because of joint position and not the condition of the pain that you're having. So sometimes the condition develops because the position's been out for a long period of time, and repetitive strain and repetitive patterns start creating the inflammation and stuff like that in your body. You just can't take anymore, so it starts building calculi, or the arthritis starts to develop, or degeneration. So we want to be careful and really be conscious and aware of our position of our joints to help prevent future knee replacements and hips and shoulders and all that good stuff, and to keep us going and being as active and vital as we can be. So the first thing I'd like to talk about is the functional design template that the body's supposed to be in. So everything needs to be pointing straight, right? So very basic. So our feet need to be pointing straight. A lot of people walk with their feet turned out, and you can see that puts a lot of strain in the hip and in the knees. Some people have a foot turned in, or both feet turned in, or one foot turned out. So we want to stand, or we want to have our low joints, our shoulders, our hips, and our knees, and our ankles all in one kinetic chain, all in one line, both sides. So when you look down, you don't want to stand too narrow, you don't want to stand too far apart. You need to create a good base of support based off of your body. So if we're standing in that position, our base of support, we have a center line of gravity that comes up through the floor, through the belly button, through the sternal notch, through the nose, and out the top of the head. That starts creating our left and right postural balance. So if you notice, if you do that line, or if you look at yourself in the mirror, your head might be off to one side, or the shoulder and head. And the body, where it has dysfunction, it starts to create compensation. So sometimes if it's here, it has to rotate a little bit for balance, or something else has to scooch a different direction because your body wants to be balanced. So it's going to do whatever it can to make that happen. So we want that center line of gravity, a nice vertical line. We want our shoulders, hips, knees, ankles stacked on top of each other. And then we want to start looking at our horizontal lines. Our shoulders should be level, our hips should be level, our knees should be level, and our ankles should be level. So depending on what you do, sports-wise, if you're a tennis player, or you're playing golf, or you're sitting at your computer all day, or you carry a purse, those start creating imbalances left to right. Now our muscles, the balance from backside to front side, from outside to inside, stabilize the bones where they're supposed to be. Without muscles, the bones would just flop around, except for the fascia. And so we want good balance to help maintain the joint position. Every bone has a place where it articulates. And so those articulation points have certain surfaces on them that are meant to be able to be next to each other and rub together. The tendons go through little grooves and all that stuff. So the better muscular balance, the joint holds its position, and then we don't have wear and tear, constant rubbing on those joints or those tendons or the bursa and so forth. So we want center line of gravity, vertical load over our shoulder, hip, knee, ankle. That creates 90-degree angles. So the musculoskeletal system has a series of these 90-degree angles in its functional design template. So we want to start looking at that from the front view in the mirror. Sometimes you'll notice your feet turn out but your knees turn in, or your feet are straight but your knees turn out. And so these are all things that identify if there's a weak muscle, whether it's the glutes or the adductors and stuff like that. So we can start looking at what do we need to strengthen? What do we got to do here? All right, so from the side view, you want ear over your shoulder, over your hip, over your knee, over your ankle. Common posture is people are rounded, shoulders are hinged forward, your hands should be at your side, thumb pointing straight forward. So head, ear, shoulder, hip, knee, ankle. This creates dynamic tension from the front of our body to the back of our body. The better the dynamic tension, we're like a sports car. We have great aerodynamics. So the gravitational forces pressing down on us then don't take as much, don't create bulging discs and things like that. Head forward, has more weight, stresses the cervical spine, stresses the mid-back. Before I turn to the side, or the pelvic tilt from the ASIS, this little bone right here, anterior superior iliac spine, PSIS, posterior superior iliac spine, should be a 4-degree anterior tilt kind of angle. So if you look at your belt in the mirror, it should be that water would run off the front of that belt. If it's too much, like this, we start getting the bigger booty. Abdominal wall starts spilling forward, so you look a little like you got a little fupa going on there. So just by bringing this up, your guts spill back, everybody can lose an inch or so, which is nice. And then you take the strain off your back. You're not creating too much of a lumbar curve. If the pelvis is tilted too back, you have no butt. So for those of us, like myself, that need a little bit bigger derriere, we want to tilt our pelvis forward a little bit more. If you don't know, grow. So what that means is if you're tilting forward and tilting back and playing with that, at some point your head's going to lengthen towards the ceiling. Where you're the longest here is where you should be. So a great way to figure this out and help start creating balance from front to back is throughout the day, go stand against the wall, feet pointing straight, hip width apart, okay? This forces, the wall forces our ear over our shoulder, over our hip, over our knee, over our ankle. So in this position, we're perfectly balanced. So stand here for 3 minutes, your body starts adjusting to where it needs to go. And the hands should be pointing to the side, thumbs pointing forward. So when you're in this position, if you have a bigger caboose, you can scoot your heels out an inch or so. If your heels are too far back and you got the bigger caboose, you're going to feel like you're falling forward. So in this, when you're doing this, that's one rule of thumb that can be altered a little bit. Also, if your head's really far forward and you got that big hump right here, it's going to be hard for you to bring your head back to the wall. You need to ease back into it, so you can put a little pillow back there and then slowly let the head come back, and then over time you can remove the pillow. So you do that for 3 minutes. So we have our front posture, center line of gravity perfectly balanced, not offset left or right. Vertical load joints, shoulder, hip, knee, ankle, boom, boom, boom. Left or right shoulder balance, hip, knees, ankles. Vertical load line, ear, shoulder, hip, knee, ankle. Stand against the wall, 3 minutes, walk away, try to remain there, grow if you don't know. And try to squish that in really quick. So I hope you enjoyed health tip number 2. Please check us out at renewmyhealthnow.com. I've really enjoyed it. Next time we're going to be wrinkle-free. We look forward to hearing from you. Any of your comments, please jump on. Blog, also if you're a healthcare professional and want to submit a video, contact us at renewmyhealthnow.com, and then also just jump on there and blog away. We have lots of things coming up that we look forward to. Appreciate it. Have an awesome day. Bye.